歡迎大家嚟到今日。
Welcome to the press briefing. With us today are Dr. Chang Shuk-Kwan, Head of Communicable Disease Branch of the Center for Health Protection, and Dr. Lau Ka-hin, Chief Manager of the Hospital Authority. Dr. Chang, please. Last night, we had 21 newly confirmed cases. Case number 12965 to 12985. In 20 of the cases, the N501Y and T478K variant was detected. Result is pending for one case. 13 imported cases and 8 import-related cases. These were detected at the hospitals or the testing centers for case 12966. This is a staff working at a dispensary at Hands of Tuen Mun. The onset date was the 1st of January. He started experiencing a fever, and according to our investigation results for 12611, the patient visited the dispensary on the 6th for a short period of time, and we confirmed this via CCTV footage. According to the home genome sequencing results conducted by PolyU, it was found that his daughter also carried the Omicron variant, and the whole genome sequencing results matched completely with case 12911. So there was that was a possible route of transmission. For case 12977, she was the family member of 12821. 12966 was unvaccinated, while 12977 received 2 doses of BioNTech. Together with 12967, they were both family members of 12821. They were sent to hospital from the quarantine center. For 12967. Both of them were sent to quarantine center on January the 5th in the morning. For 12967, the patient started experiencing fever on the 9th. On the 5th, and the 4th, he was tested, and on the 5th, he was tested at the quarantine center. Since his family members tested positive, he didn't go anywhere else. For 12967, like we said yesterday, on the 5th, he visited 757, and for the rest of the time, he stayed in office. For 12977. On the 4th and 6th of January, she was tested, and both results were negative. On the 9th, he had a fever at the quarantine center, and she tested positive. Both of them received 2 doses of the BioNTech vaccine. For 12969, she was a family member of an Indonesian helper who tested positive earlier. This is case 12969, a 32-year-old female living in Onning Garden. We talked about this case yesterday. For case 12970, he worked at PricewaterhouseCoopers, and he had fever on the 8th, and on the 5th he was sent to a quarantine center. We talked about the activities he took part in earlier, and like case 12969, he was unvaccinated, and there were two staff members, 12979 and 12985, who worked at CITIC Securities Company. They both received 2 doses of BioNTech. Case 12979, he lived in Meifu Sanshun before being sent to quarantine. He stayed in Alva Hotel by Royal, and on the 9th, he visited a restaurant called Seibo Sektong, and he worked at CITIC Securities Company. And on the 8th, he was sent to a quarantine center, and he was tested. On the 6th, the result was negative. On the 6th, he went to the Park and Shop on 4th Street, North Point, and on the 5th, he dined at Genki Sushi at about 4 p.m. On the 4th and 5th, in evening time, he went to a fitness center in North Point called Gym 24. He went alone. He used the equipment there. He didn't have a shower there, but he did use the changing room. We are now tracing whether he had any close contacts there. So the people who were present or customers who were present had to undergo compulsory testing. And in the afternoon, on the 4th, he visited Lee Garden Center for acupuncture treatment, and he visited Telford Mall, and he went into Broadway and McDonald's, and in the evening, he visited Club One in Tsim Sha Tsui to attend a company banquet. There were 8 tables at the banquet, but he stayed at his own table, and others at the same table were classified as close contacts and had to be tested. And on the 2nd of January, he visited Pure Fitness in Causeway Bay, and he visited Green River Restaurant, where he dined alone. For the family member of 12913, a 16-year-old student studying at St. Francis Canossian College, and she last went to school on the 7th of January. We talked about this case yesterday already. Yesterday, a reporter asked a question about Connaught Road West. I made an error. The correct address should be 155 Connaught Road West, ground floor. It was a private premises, and we visited the premises already. It wasn't a public place. A person had drinks with her friends there. Apart from the 5 persons who visited that place, another 7 or 8 people were sent to a quarantine center. We also have some preliminary positive cases. There are about 5. One is a 4th case from Mason Building. The patient tested preliminary positive. On the 7th, the patient visited a quarantine center. He received 2 jabs of BioNTech, and starting from the 9th, he started experiencing a sore throat. And on the 10th, he was sent to accident and emergency and tested positive. The patient visited a construction site at Lohurst Park for an inspection, and on the 5th of January, he visited the 10th floor of a building in Jordan for training, and we will trace the students who were present there. And on the 4th, he had an inspection visit at a construction site at Lotus Park.
For 12945, which is the dispensary case, there's another family member, a 11-year-old boy. We know that he was feeling unwell previously, and another female, 45 years old, is also tested positive preliminary. The 11-year-old boy studies at AD and FD of Pok Oi Hospital, Mrs. Chang Yam on Millennium School. And the last day he was at school was January 7th. On January 3rd, he started having a fever, and he visited a doctor, Dr. Chung, in Gold Coast, and he was accompanied by his mother. His father joined later on, but he wasn't able to recall the details until we asked him about it. He was not tested at that time, and on December 31st, he visited Sha Tin Outback Restaurant and also a bookstore, a commercial press in Newtown Plaza. And then after visiting the doctor on January 3rd, he visited La Cafe and sat for a while. On January 5th, he didn't attend school, and on January 6th, he returned to school and took the school bus home. He was driven to school by his family in the morning. The mother, 45 years old, is a housewife. On January 5th, she started having a fever. She also visited Outback Restaurant on December 31st. And on January 1st and 2nd, she stayed at home. On January 3rd, she went to have her ID card replaced in Siu Lun Government Building, and then she visited Pacific Coffee. She also went to Marketplace in Gold Coast, and around 1 p.m. to 1:30 p.m., she visited Dr. Chang Si-min. On January 7th, she went to 2 secondary schools to submit application, one in Tuen Mun and also a Ma Ho Bun school. And she also visited V-City and also Yatta. There's also another preliminary positive case, a 51-year-old female. She's a security guard at Penny's Bay. So she has been taking tests on a frequent basis, and she was still negative on January 8th. On January 10th, she had a sore throat, and she was tested preliminary positive with a CT value of around 25, 26. She lives by herself in Po Tin Estate, Block 3, and she usually takes the shuttle and then the MTR to work. So basically, in the last 2 days, she's just been around her home and near the work area. She is in charge of distributing supplies at Penny's Bay and also helps carry baggage up to the quarantine facilities. And she always wears a full PPE gear. She works till around 9 p.m. in the evening. And she would take her meals in a container. So those who had eaten with her would also be quarantined, and we are going to track down other contacts. She lives in Tuen Mun, and she works in a quarantine facility. We are going to track down the source of the infection. So we have seen quite some cases in Tuen Mun, and we believe there may be a silent transmission in Tuen Mun area. And we've only identified some of the cases at a later stage, so we believe that there is transmission in the community, and many of the confirmed cases have not been vaccinated. We call upon the public to see a doctor and to be tested, even with very mild symptoms. Well, there has not been a local case for some time, and maybe people have become a bit relaxed. Now the situation has changed. So please remember to test those who visit doctors for sore throat or mild colds. The government has arranged for test centers and mobile test stations for those working and living in Tuen Mun. 8 of them will be opened in the next few days, including Siu Lun Building, starting from 2 p.m. for a consecutive 7 days. It will be open from 9 a.m. to 10 p.m. And On Ting will also extend its hours from 8 a.m. to 8 p.m. Kin Sun Community Center also 8 a.m. to 8 p.m. And starting from tomorrow for 3 consecutive days until Friday, Tuen Mun will also add 5 mobile testing stations that operate from 10 a.m. to 8 p.m., including outside Yao Oi Sports Ground, Yao Oi basketball court, and Tai Hing Community Center. We will also look at the demand and see whether we need to further extend hours and dates. Thank you. Dr. Lau will now tell us about the situation under the hospital authority. As of 9 a.m. in the past 24 hours, there have been 28 reported cases. In the past 24 hours, 8 more patients have been discharged from hospital. Altogether, 12,304 patients have recovered and been discharged from hospital. As of 9 a.m. this morning, 406 patients are staying in North Lantau Center and also public hospitals, the AWE, and all 406 patients are in stable condition. As of 9 a.m. this morning, negative pressure beds in total are 1,085, utilization rate of 58%, and negative pressure wards 606, utilization rate of 68%. That's all for my report today. We now take questions. Please identify the organization you represent before you ask your questions. The gentleman to the left. Good afternoon. I'm from TVB. I'd like to understand the situation at 155 Connaught Road. Yesterday, Dr. Truong, you said you made a mistake and gave us the wrong number. So did you just had a wrong recollection, or was the information given to you incorrect? So do you think someone is intentionally withholding information? Can I also ask whether the CITIC Securities is an outbreak? I'd also like to ask about quarantine at Penny's Bay. Some people have said that they have been sent to Penny's Bay for 4 days, yet they have still not been tested. And so they had to wait to be tested. Do you not have enough people working at Penny's Bay, or is it because it's over capacity over there? Because of the short Omicron transmission period, now the new quarantine arrangement is 14 plus 7 days of self-monitoring. So So you announced that only cases after 12941 will be subject to this new arrangement. Why is that the case? Because some cases previously still are not subject to these new regulations. Why is that?
嗰個155定1
For the street number, I remembered it wrong yesterday. I didn't realize that I said 115 instead of 155. I checked our records, and the correct address should be 155 Connaught Road West. The information provided was correct. There is an outbreak at CITIC Securities. There were 4 plus 1 who visited the company in terms of quarantine and testing. Recently, we have seen an influx of close contacts entering quarantine centers. And this morning, we examined the relevant arrangements to see if the process could be improved. We call upon the public to understand the situation. In terms of our policies and measures, there would be specific timeframes. For instance, measures for visitors who arrive at Hong Kong. So, looking back, perhaps certain adjustments could be made. Next question, please. I'm from Now TV. For the address at Sai Ying Pun, the initial version was that there were 5 people, and eventually 7 or 8 people were sent to quarantine. When did you find out about these 7 or 8 people? Were you informed by the confirmed case? What is the latest number of attendees who attended the birthday party? If you were only informed today, was there any case of contravention? Yesterday, Dr. Chuang said no CCTVs were found at the restaurant, but according to a media outlet, there were at least 8 CCTVs at the site. Are you going to inspect the CCTV footage to find out about the situation that day? There were 5 people who had a drink with her at that time. Of course, we had to investigate the situation by getting in touch with the restaurant and her friends. We will find out whether the premises is a restaurant or a residence. So we will obtain more details from the source. For the birthday party, I do not have new information to report. I do not expect a spike in the number of attendees. On the CCTV footage, I looked into the situation again. The person in charge of the restaurant only assumed work recently. There were CCTVs installed at the restaurant, but they were not in operation that day. Outside the restaurant, at the corridor, there could be CCTVs installed by the shopping mall or other restaurants, but those CCTVs could not capture footage at the entrance of the restaurant. Since day one, we have made use of the CCTV footage in order to identify who attended the party and when. The contact tracing office is staffed by police officers and other colleagues. At that time, we tried to find out whether other CCTV footage were available. For the first confirmed case, that case was discovered through a CCTV outside, so we knew that the confirmed case entered the restaurant at about 9:30. The lady on the left, please. I'm from Cable TV. You said a confirmed case visited Pure Fitness in Central. Can you give us the exact address for the 51-year-old female security guard? You said you are still investigating the source of her infection, but according to preliminary results, do you feel that she was more likely to be infected in Tuen Mun or Penny's Bay? For the birthday party, the address took place at 155 Connaught Road West. Can you confirm whether it was Sushi Zing? We visited Sushi Zing this morning, but the staff told us that no one tested positive, and the shopkeeper said that no staff from the Department of Health visited the premises. If that's true, why didn't you take any action over the past few days? Among the 5 people who had a drink with the confirmed case was an officer from the liaison office among them, and are they now under quarantine? For Miss Chang, who attended the party, said it was difficult to ascertain the situation at that time. What is your view on this? For the person who visited Pure Fitness, he went on the 2nd, and the fitness center was located in IFC, and I believe the location was not Sushi Zing. So the premises was closed, so perhaps that is why you couldn't identify the premises. 1 tested positive, another 3 was sent to quarantine. I have no information on the rest. We will take a question in English.
Okay, Dr. Chuan, first of all, I'd like to ask about the pharmacy family. Can you give us more details about whether the mom that tested preliminary positive is also vaccinated, and both the 11-year-old son and also the mom went to a particular clinic, but they were not tested even though they had no fever. Even though they had fever, can you tell us whether there was any shortcomings on the clinic's part for not giving them COVID tests? And whether patients from that clinic as well as the doctor have to be quarantined as a result of their infection? And can you also update us about the situation of Tuen Mun? How concerned about silent transmission chain in that area, and what's the cost for that? And for the preliminary positive case involving the security guard, can you provide us with more details on the potential of where she might have been infected? Thank you.
Mm-hmm. So the pharmacy family and 2 of the members had visited a general practitioner in Tuen Mun on 3rd and 5th January respectively, and both of them had fever, and I think we have to, I would like to appeal to the public that if you have any symptoms, do go to see a doctor or get a test as soon as possible. And also the family physicians do give them tests for any patients with mild symptoms even. It is understandable because before end of December, Hong Kong has had no local cases for quite a while. So there may be a lack of alertness in the local community, including the medical professional as well as the general public. That's why we would like to appeal to all to be vigilant about their symptoms and testing. So for the other clients who visited the clinic, we are tracing them and will advise them for testing. And for the doctor, we are still we understand, and she only wear a surgical mask and examine the throat of the child. That's why we will consider her as a close contact and advise put her under quarantine. And we have quite a number of cases, including the pharmacy family who are staying in the Tuen Mun area. And also we have a preliminary positive case who live in Tuen Mun. So we believe that there may be some silent transmission in the community, and we cannot exclude this possibility. That's why the government is arranging increasing the number of mobile testing centers in the Tuen Mun area up to 8 testing areas, the testing facilities and we also extend the operating hours to facilitate all the people living or staying or working in the Tuen Mun area to get free tests in the coming few days. So I appeal to the people staying or living or working in this area to get tested so as to stop the transmission in the community. So for the preliminary positive case, she's working in the Penny Bay Quarantine Center, so we cannot exclude the possibility that he might have got the infection from work. But as she is also staying in Po Ting in Tuen Mun area, so there is also a possibility that she acquired the infection from the local community. So we have to ask for the whole genome sequencing to compare whether we can have any clues on the possible source of infection.
下一題，問多條英文問題啊。
Another English question.
A few questions from SCMP. So is Tuen Mun classified as a high-risk district now, and should people avoid going there unless it's necessary? And for the family from the pharmacy, did the mom also work in the pharmacy, and did they wear a mask in the pharmacy? So as most imported cases are Omicron cases with shorter incubation period, why not shorten the quarantine period for incoming travelers as well? And so an expert said if there are no untraceable cases in the coming few days, does it mean that the fifth wave of pandemic is well contained? Do you agree with him? And do you expect to have more untraceable cases coming? And also, among the found attendees at the birthday party, how many people did not scan the Live Home Safe QR code? Thank you.
We do think that there may be a risk of silent transmission in the community. That's why we are arranging increased testing facilities and ask people living and working in the Tuen Mun area to get free tests as soon as possible in the coming few days. So I think in the coming few days, people, the general public should try to avoid social activities. So of course, unnecessary activities should be avoided. And for the pharmacies, we understand they are wearing masks in the pharmacy. And the 2 family members who are preliminary positive, according to the history, they do not go to the pharmacy to work. I mean, there's only the 1, 2, 9, 4, 5 should sometimes help up in the pharmacy. And I understand the incoming traveler policy will be dealt with separately. This is different from the local close contact. And we have to be closely monitoring the situation in the coming few days, especially with the increased testing in the Tuen Mun area to see whether we can find more cases and stop the transmission. So I think we need to observe for a few more days. I do not have information on the Live Home Safe.
下一題，呢邊前邊呢位黑色衫。
Next question. I'm from Hong Kong 01. The 155 Connaught Road West private premises. Well, this morning, our reporters visited the area. Well, I think the 155 Connaught Road should be actually a shop selling dried seafood. Is that the place? And yesterday, new regulations are implemented about the quarantine being 14 days plus 7 days of self-monitoring. So do you need to also have the bracelet to keep track of the whereabouts? And from January 2nd to January 10 in South Horizons, we also see close contacts over there. Are you afraid of an outbreak over there? Would South Horizons become the next Tuen Mun? 155 Connaught Road West is Block 3. I'm not exactly sure which part you're talking about. I've only seen the photo and the video, but it seems I'm not sure whether we're talking about the same place. But then for those who have been to 155 Connaught Road West, they would be subject to compulsory testing. For the new measures, we are just following what has been carried out previously. For those who have been vaccinated and to have taken blood tests, we still handle it the same way, but we don't think that this is what we need to do now. So it would be the same arrangement that they be subject to compulsory testing on day 19. All close contacts or new arrivals and everyone should try to avoid gatherings and avoid other activities unless it is essential. You mentioned South Horizons right now. Am I correct? What was your question? Close contacts? Well, I'll have to take a look at the situation to see whether there are many confirmed cases from South Horizons. Right now, it is not. Next question. The lady in pink. Good afternoon from Economic Times. Well, Dr. Chuang, you said there are 5 preliminary confirmed cases, yet you only gave 4 in detail. So is the number 4 or 5? For the Mason building confirmed case, can you specify the gender and the age? So what exactly is the occupation of this person? For the crew member who has visited the dispensary, you said that he was donning a mask then. So how about the family? And for the person who works at Penny's Bay, has she been vaccinated, and would you need to extend the quarantine period of those in quarantine right now? And there's also a group of people who have entered the facilities yet left afterwards. So has this person approached this group of people? Do we need to resend them into quarantine? Case number 12985. For the acidic close contacts, how many contacts have been sent to quarantine? Well, about 40 people have been sent to quarantine when case number 12825 was confirmed positive. The CT value was 30 to 34, so which wasn't too low. But he has already been in quarantine for a few days. He was sent to quarantine on January 8th. The activities that I mentioned were earlier, so I am not sure what the CT value was at that time, and we didn't know when he was infected. The Penny's Bay worker has taken 2 shots of Sinovac. We are still tracking down the close contacts. Should be basically the staff she works with. She does not have too much contact with the quarantined people. And she might talk to those in quarantine through a window. For the dispensary case, so the crew member wore a mask and everyone else was wearing masks at the time. I think he only spent around 5 minutes there. The person from Mason building is a male, a 40-year-old male. And the preliminary positive cases would include the one who works in Mason Building, 2 family members of the dispensary, 1 family member at Awning Garden, and the one person who works at Penny's Bay. Next question. The lady to the right in the last row. Hello, I'm from Commercial Radio. I would like to ask about the Mason Building preliminary positive case. Is she living also in the same direction as the others confirmed cases? Would you consider holding the doctor responsible at Gold Coast for not testing those people for COVID? And then for the worker from Penny's Bay, do you think she was infected in Po Tin Estate, in Tuen Mun, or at Penny's Bay? The Mason Building case is actually the same family member from the previous confirmed cases. So that is actually the family member of the Indonesian domestic helper. The private doctor is not held liable because he's a private doctor. At the diagnosis, he might believe that it is not COVID and other symptoms. I hope that people will stay vigilant and be on guard, especially doctors. We have already sent out a letter to private doctors reminding them on December 31st. It has been some time since we have seen the last local cases, and some doctors may have let down their guard and felt that other symptoms and are not COVID. We're also going to look at the genome sequencing for the 51-year-old as well.
Next question. The reporter at the back, please. I'm from RTHK. For 155 Connaught Road West, you said it is a private premises. Is it a scheduled premises? Why was it only included in compulsory testing today? You said the information provided was correct. So shouldn't it be included on the compulsory testing list earlier? Dr. Chuang talked about Block 3, 155 Connaught Road West. Are you referring to number 3, ground floor of 155 Connaught Road West? I just want to clarify the address. It was a gathering with 5 people, and you said there were about 7 close contacts. Were they people at the same table? Can you clarify their roles in the gathering? You said for case 12611, he visited the dispensary for a few minutes. What is your assessment of the route of transmission since they all had a mask on? Today we have less preliminary positive cases. Does it mean that the outbreak is easing or improving? According to the address provided, the location is number 3, 155 Connaught Road West. We spent some time confirming the address and whether it was a scheduled premises. For restaurants, normally we would issue a compulsory testing notice, and for residential addresses, we would pinpoint the entire building. So we spent some time clarifying the situation, and we found that it wasn't a scheduled premises. That is why it was only included in compulsory testing today. Since we had to deal with a lot of locations recently, we want to clarify the information before we impose compulsory testing. The facility has a few tables and sofas. It is the environment is like home, except that it's more spacious and people could meet and gather. So the attendees were all friends. So all the people present at that time were considered close contacts. For 12611, we that person was the only one who had an encounter with the confirmed patient. Earlier during the pandemic for Delta cases, at times we could not identify the route of transmission, but since Omicron is possibly more contagious, we cannot rule out the possibility of infection even if everyone has a mask on. According to whole genome sequencing results from PolyU, and we have identified epidemiological links, that is why we arrived at the conclusion. Apparently, we have less preliminary positive cases today. But you might be aware that many recent cases were imported. We have banned a lot of flights from many places. That is why we are seeing less imported cases. We still have a number of local cases, and fortunately, many were identified at a quarantine center. For the rest, for the case living in Wan Chai, we are yet to identify the source. The speaker's not using the microphone. They were all friends. That is why they showed up. Some would cook, others would entertain the guests, and there were 3 other people there. They were in 2 groups, but basically they were friends. So it was similar to a home setting. The speaker is not coming through the microphone. I don't know how we should interpret the situation, but except that they might not necessarily stay at the same spot within the premises. Next question, please. The reporter in gray, please. I'm from In Media. For the 7 to 8 attendees, did they attend Whitman Hong's birthday party afterwards? As far as I know, 5 of them visited that party. Next question. The reporter in green, please. I'm from AM 730. For 12967 and 12977, that was a couple. Did they dine at Jockey Club during the incubation period? If so, how many people were affected and had to be quarantined? For the security guard at Penny's Bay, apart from handling the luggage of people to be quarantined, did she have other duties? Was she mainly in contact with arrivals in Hong Kong? And you said she visited 3 main places in Tuen Mun. Did she dine at those places? Is this considered an untraceable case or a case linked to an imported case for the male flight attendant? Could he possibly be infected through the luggage or physically? At On Ning Garden, there's a new preliminary positive case. Is the 32-year-old case also the family member of the Indonesian domestic helper? That person visited the Millions at the race course on the 1st of January, and at that time we believe the virus wasn't contagious, and later the case was tested and no one was put under compulsory quarantine due to that. For the pharmacy, several other staff members as well as family members were sent to quarantine since some relatives helped out at the pharmacy. Can you repeat the other question, please? The speaker is not coming through the microphone. we believe contact between people is more risky than infection through objects such as banknotes, but we could not rule out any possibilities. For the staff member at Penny's Bay, she was responsible for distributing different supplies, carrying luggage, answering questions from residents through a window, etc. The speaker is not coming through the microphone.
密切接觸者
Most of them in Penny's Bay are currently close contacts. Well, of course, we also need to look at those arrivals. Well, currently, it's only a preliminary positive case. When it's confirmed and we cannot find the linkage, then it will be seen as an untraceable source. So the total number is 20. The Awning Garden case is a family member who works at the YSL counter in Sogo. So the last day of work was January 4th, and this person does not know the confirmed case previously. So she works in the back office, and sometimes she would walk around the front counter, and she would eat in the back office together with her colleagues. 12903, 12969, and 12916, her family members are all confirmed cases. She became febrile on January 11th. She was already sent to Penny's Bay on January 6th. So there is not a high possibility that her colleagues would be infected. Next question. Good afternoon, from Ming Pao. I'd like to ask about the Tuen Mun dispensary. One case 12611. So did you only know about the situation after questioning 12611? So on which date did you confirm that 12611 visited the dispensary? So the father in the dispensary started having symptoms on January 1st. He was not tested during that period. Well, because if a case had visited those premises, how come the father was not tested? So both patients who had fever for the preliminary constituted cases visited Dr. Cheung in the Gold Coast Piazza. So if Dr. Cheung had conducted a test, then would the damage actually be reduced because the boy has been to school. Also about the Penny's Bay worker, she's in charge of distributing supplies and answering questions. Has she been in contact with any confirmed cases whilst she was distributing supplies? I'd like to ask about 12967. Is that the person who has visited the Millions in Hong Kong Jockey Club? Our understanding was that the function on January 1st was a wedding. Could you confirm that? How many attendees were there and how many people were sent to quarantine? I'd also like to confirm whether the Chinese medicine pharmacy next to that dispensary is also connected, and how many people altogether from there were sent to quarantine. Yesterday, we learned of the father being confirmed positive. He mainly works in the dispensary and walks around and spends his time around hands. We asked the people whether they have visited the dispensary. We would show them photos, and when we asked 12611, he recalled that he did visit a dispensary after identifying it from the photos, but he couldn't remember when he was there, probably on December 27th. And we were able to confirm that via CCTV, that he did visit that dispensary on December 27th buying shampoo. The father, who started feeling unwell on January 1st, did not visit a doctor. So we appeal to the public to please go see a doctor if you are feeling unwell. And we remind doctors that even if you only identify mild symptoms in the patient, to please conduct a test. We are still following up on the Penny's Bay workers case to see who she has been in contact with. The Jockey Club case should be case number 12977. He started feeling unwell on January 9th. He was sent to quarantine center on January 4th. And she visited the Millions on January 1st. So we did issue a compulsory testing notice, but we don't think that place was a high-risk area. Next question. Last question, please. The gentleman in the back. I'm from Dot News. Or are you not able to keep up with following up on these cases? Would you try to expedite the process to control it faster, or what kind of measures would you adopt? Everyone is very concerned because primary schools and kindergartens would be suspended from Friday. Would you also consider suspending secondary schools as well? And what was the basis for that decision? Tracking down close contacts to quarantine and sending the confirmed patients to hospitals are measures we adopt to control the epidemic. Well, on the speed of tracking down, I'm not too sure of what your question is. Well, we'll never be able to catch up with the epidemic because we would only try to track down the cases when there is a case. We do want to try to control the epidemic. Do you have any new ways that you could introduce me to? Well, minimizing social contact would be a good measure. Visiting the doctor when you're unwell and getting a test done when you have symptoms would all be ways in which we could try to control the epidemic. But for keeping track of the cases and tracking down the cases, it could only happen after cases are confirmed. And as for school suspension, it's up to the government to make this decision. This ends the press briefing today. Thank you.